Hi, I'm Dan Resnicek from Pacific Northwest Urology, and recently I made a video on the limitations of the Urolift procedure. And one of the limits that I put on that video was a large median lobe. At the time, I felt that a very large median lobe could not be adequately compressed with the use of the Urolift procedure. Well, turns out I think I may have been wrong on that one. In that video, I went over how a large intravesical median lobe may have difficulty compressing it to the side with the use of a Urolift clip. Recently, I had a patient who didn't really have any other options other than a Urolift, and he had a very large median lobe. And it turns out we were very successful in using the Urolift procedure for this patient. On the screen here, you can see the dramatic effects of the Urolift procedure on this median lobe. This large structure in the middle of the screen that was blocking the patient's urinary stream has been pinched to the side, now on the right side of the screen. It dramatically opens the channel and allows this man to urinate following the procedure. So in this video today, we're going to show the specifics of how you perform a median lobe Urolift procedure. We're going to show the case specifics related to this case, and then I'm going to show the entire video of how I performed this procedure. So how does Urolift treat a median lobe of the prostate? Well, first, we're going to go over how Urolift treats a normal prostate and then how it treats a median lobe. So what is a normal anatomy? Normal anatomy for prostate looks like this, but as men age, the lateral lobes of the prostate grow inwards, leading to a picture more like this with a cystoscope. If men have a median lobe, if you treat the prostate by putting in Urolift clips to open up the central channel, the median lobe acts as a ball valve and is sitting in the bladder. And as men urinate, it sits there and blocks the flow of urine. What a Urolift will do for the median lobe is compress that tissue down and out of the way so that it no longer blocks the prostatic channel. Now, let's go on to this procedure with a very large median lobe. All right, so the case details. So we had a 45-year-old male with multiple comorbid conditions, a very poor heart, and a very poor surgical candidate. He'd had urinary retention for over a month. We've tried to remove his catheter multiple times. And here's his MRI scan. His MRI scan shows his bladder and his prostate. And if you saw a second ago, he had a large median lobe bulging into the bladder. You can see right about here, this median lobe is a big circle, pokes into the bladder right next to the catheter that's sitting in his bladder. And on this view, I think it's more pronounced. This is a coronal view, and you can see this bulging median lobe, big circle, pokes into the bladder. So now let's go on to the full video. Okay, starting the procedure, putting the camera in, you can see some lateral lobe hypertrophy, some tissue on the sides. I'm now kind of up in the bladder, and I'm going to exchange the obturator, the camera, for now the Urolift clip. And so now that that's in place, here in the middle of the screen, I'm going to back up, and you're going to see just how large this median lobe is. So on the screen here, this large structure just to the right of my scope in the middle of the screen is actually the median lobe. It's not the lateral lobes of the prostate. That is a very large median lobe. So the right lateral lobe's on the screen left, median lobe right here on the right. And what I'm starting to do here is starting to compress this median lobe. So the whole goal of this Urolift procedure is to compress the median lobe down and out of the way. So as I'm doing this right now, I'm compressing, and now I'm firing. And what I'm trying to do, the needle is now firing, and the suture is tensioning. I'm next going to apply the clip, and that's going to fully tension now that median lobe out of the way. And this is just the first clip on the median lobe. And already you can see it's out of the way somewhat, not as much as we'd hope at the end of the procedure. So we'll probably have to come back to that. But you can see right here already the component of the median lobe next to the lateral lobes is pushed way to the side. So next, what I'm going to do is I'm going to expose and open the prostate, kind of in the middle of the prostate, the usual lateral lobes, the usual Urolift type procedure. So the first clip here is on the patient's left lateral lobe. I've already fired the needle. Next, I'm tensioning the suture. You can see the suture right there, and the clip just fired. So you can now actually see the end piece from my prior median lobe and a little bit of an opening into the bladder, but still not good enough. So next, I'm going to focus on the typical Urolift procedure. And again, you can see the median lobe is still present. Now I'm going to focus on the other side here on the patient's right lobe of his prostate. I've looked down at the viru. Now I'm looking up to make an anterior channel. I'm going to fire this clip right here. Okay, so the needle is fired through. I'm compressing the prostate, advancing to tension the suture. And then once you see this nice white line right about here, I'm now going to fire that urethral end piece. So that's now tension that out of the way. So already you're starting to see the prostate open up in the middle. What that's going to do is going to expose that median lobe so I can see exactly how to tension it at the end of the procedure to finish up. Okay, so looking back, what I've done so far, I've got a good opening right there. I'm going to put another clip up here. So you can see a clip right down below was my lateral lobe clip I did earlier. You can see the clip on the median lobe that we did kind of closer to the bladder neck. And so what I'm going to do is stack these clips in a kind of a vertical fashion in the lateral lobes. I'm going to fire one above my previous one. And what that's going to do is give us a really big opening so that we can get a better picture of the median lobe. So I'm now going to fire this urethral end piece now after tensioning. Okay, there it's fired. And now you can already see this part of the prostate looks really open. I've got a good channel there to visualize that median lobe better. All right, so as I exchange here now to a new clip to fire, I'm going to take a look back and see where we're at. And you can see the median lobe, I can kind of still push it over here to the side so it's not completely compressed and out of the way. And I'm deciding, am I going to now clip the median lobe or am I going to clip this right lateral lobe on the left side of the screen here to get it out of the way? Well, kind of thinking back and forth, looking at that median lobe, I think now is probably the best time to treat that. I think the left lateral lobe has been treated sufficiently. We get a good view of it. So now I'm kind of committing to that median lobe. And what I'm going to do here is put the camera and the clip a little bit further than my last clip that you can see here. You can see that urethral end piece going past that. And now I'm compressing. I'm compressing downward and laterally. That downward and lateral compression is going to push this median lobe out of the way. So when I fire the clip, it's going to pinch that median lobe out of the middle of the urethra so he can pee better. So I fired the clip. I'm now tensioning, bringing it even a little bit more forward than the last one. And there's the new urethral end piece. And you can see immediately there's a very dramatic improvement. That median lobe is no longer acting like a ball valve. It is now well out to the side. You can see a clear channel all the way from the apex of the prostate all the way into the bladder neck. And that channel, although it's not perfect, it's a very good channel all the way through. He's likely to pee already. I still think that the right lateral lobe here on the left side of the screen could use a little bit more compression laterally, especially down here near the apex. So I'm going to fire one more clip here. And you can see me compressing and firing. And now I'm going to tension that suture, kind of advancing the camera until we see that nice white line again. Tells us we're at the right amount of tension, and firing that urethral end piece immediately kind of pulls that out of the way. Again, now we can see a great anterior channel all the way from the viru all the way into the bladder. So very high success, or very high chance of success, I think, with doing the procedure, and it turned out great. I left a catheter in overnight because he'd had a catheter in for really a month and a half. And immediately after removing the catheter, he was able to pee. And again, I'm just taking another look here just to make sure there's no other areas I want to compress. And that's it. So in conclusion, this procedure showed me that Urolift might be a good option for some men with a large median lobe. We could see at the beginning of the procedure, this lobe was enormous, completely blocked his whole urinary stream. It was acting like a ball valve effect on the prostate. After the procedure, he was able to void the day after surgery when the catheter was removed. This was a pretty great success, and not everyone can have the success with a median lobe, but it does show that this procedure can be done in some individuals with a large median lobe successfully. Thanks for watching. Again, Dan Resnicek, Pacific Northwest Urology.